Why is screening important for lung cancer patients?
I was never screened for lung cancer. Even though my doctor knew I was a long-time smoker, he would just send me for an occasional x-ray. Now, all of us who have some knowledge of lung cancer know that only 10 to 15% of smokers get lung cancer. However, the country is making screening more and more available to more people, particularly over 50, and particularly with any kind of smoking background. So I'm always urging people, ask your doctor, whether you smoked or not, just ask your doctor if you are in a position to get screened for lung cancer. The earlier you're diagnosed, the better chance you have for a long life.
Welcome back to Lung Cancer Foundation of America's World Lung Cancer Day social media takeover, a time to share hope and the latest research on lung cancer. One of the things lung cancer researchers are excited about right now is something called T-cell engagers. We all have T-cells in our immune system. T-cell engager technology allows your T-cells to connect to cancer cells and basically kill them off.
On Lung Cancer Foundation of America, Hope with Answers podcast looked into T-cell engager technology this past spring. This was happening just as the FDA was fast-tracking this cutting-edge treatment, offering great hope for people living with small cell lung cancer. As you're going to hear from this podcast snippet, using this technology can be a home run for people living with lung cancer.
The chemotherapy is kind of like swinging the bat for a single or a double. You're more likely to get a hit, but it doesn't necessarily win the game in itself. Now, what we've seen from the T-cell engagers is particularly exciting because we are seeing numbers that suggest more frequent hit. So, how long will this last? We need another 6 years to have any kind of sense, but really another 10, 15 to fully know. But the very early look at this class of drugs is that we're hitting a home run more frequently. We're getting a response to treatment, meaning that the cancer is shrinking by more than 30% in a higher percentage of patients than those initial immunotherapy drugs. So it's more frequently a hit. The question is, are those home runs? We don't yet know. Are they triples? We'll have to see.
Maida is one of our small cell lung cancer patient advocates. She does a tremendous job sharing her story, bringing hope to others facing lung cancer. Now, we recently asked Maida and others living with small cell lung cancer about the importance of lung cancer screenings and what they entail exactly. They were quick to point out that lung cancer screenings are a breeze. Take a look.
Lung screening it's a low-dose CT scan, so you're getting very little radiation into your system. You do not take off any clothes. There's nothing painful. People often say it's not like a mammogram or a prostate exam. You just leave your clothes on, you lay on a table for a couple minutes, they take a low-dose scan to make sure your lungs are clear. Done. It's probably the easiest screening that exists.
Anybody with lungs can get lung cancer. So by having this CT scan, they can see if you have nodules, and they can detect the tiniest of things in there, and it could allow the doctors to treat you sooner